Promoting a sound work-life balance and healthy lifestyles is particularly relevant in the healthcare sector. Working in the healthcare sector is undeniable, stressful and demanding. Stress related to long and irregular hours, health and safety hazards, heavy workloads and lower wages. It's a common picture in all 28 member states.
That was the European Union's Commissioner for Health and Food Safety, Vytenis Andriukaitis, explaining the nature of the challenge facing policymakers across the EU in connection with occupational safety and health in the hospital sector. According to the European Union's Agency for Occupational Safety and Health, musculoskeletal disorders and psychosocial risks, stress at work, are two of the biggest issues facing health workers. During 2 days of in-depth discussions, representatives from employers and workers, EU policymakers, officials from national public authorities and academics from across the EU debated the main occupational safety and health developments, the challenges and potential solutions. Zoya Antonio is a registered general nurse in Cyprus. Her experience includes 8 years as a nurse in Nicosia General Hospital's Accident and Emergency Department and working as a health visitor in schools.
From a research recently done in Cyprus, we found out in Cyprus that more than 55% of the nurses feel like a burnout. They feel exhaustion, they don't feel satisfied with their job. They feel that nobody appraises and recognizes the well-done job.
Taija Hämäläinen works as a labour market advisor at KT Local Government Employers in Finland. She focuses on issues relating to occupational safety and health, occupational healthcare and well-being at work.
It's very difficult to say what the situation is nationwide. Of course, we know that there is a lot of stress and there is high demands on the personnel, but this also varies a lot between the workplaces. There is no nationwide solutions to this, so you have to look at it at the workplace level. So you have to involve the people working there and have discussions with them that what they find are the biggest problems and the biggest stress factors, and then try to find the solutions together.
Brigitte Schiero is a health scientist and works at the psychiatric hospital of a district hospital in Dortmund. She is member of the Federal Trade Union Board of Verdi, representing workers from the health, social services, welfare and church sectors.
Vilnius ist sozusagen ein weiterer Meilenstein in dieser Thematik. Allerdings denke ich, dass wir vom Wort zur Tat schreiten sollten. Wir sollten die Anstrengungen dahingehend intensivieren, dass wir einen gemeinsamen Vorschlag erarbeiten, diesen Vorschlag weiterleiten an die EU-Kommission, damit eine spezifische Direktive ausgearbeitet werden kann.
Tjirta Alkema has been Secretary General of HOSPEEM since 2013. He is mainly responsible for leading the negotiations within the European Sectoral Social Dialogue Committee for the hospital sector. He works as a manager of the Department of Industrial Relations and Education at the Dutch Hospitals Association.
The commitment from my organisation, and that's both HOSPEEM and the Dutch Organisation of Hospitals that I represent, to the outcome of this project is that we think that solutions to the problems that we're facing can only be found by working together. And working together applies both at the European level, so social partners and the European Commission, the regulatory framework and how it's implemented, but also finding creative solutions at institute level.